Well, speaking of Kerala, let's focus now on India's numbers. And Kerala, India's daily COVID numbers jumped by 12% today as the country reported 47,092 new infections. The biggest single-day rise in 2 months. 509 deaths were also recorded. Now, Kerala contributed 32,803 cases, or nearly 70% of these new cases, and a third of the deaths. Sources in the Health Ministry say the centre has stressed on a smart and strategic lockdown to curb the daily surge, and how Kerala has not been following the centre's advice while reporting the highest daily cases in the country. Officials insist that adding that neighbouring states are feeling the impact now. Well, to talk more about this, we're joined by Dr Sulphi Noohu, State President-elect, IMA Kerala. Doctor, what would your response be to what sources in the Health Ministry have told NDTV regarding how Kerala is not following the advice, how there has to be a strategic and, smart lockdown in some places?
See, we cannot go straight into a lockdown at the moment. The national government is definitely giving some directions, a few directives regarding the COVID management. But I think the Kerala government is modifying a little bit according to the local situation. So we cannot go to a total lockdown anyway. But we are keeping some restrictions in some areas according to the case rates. I think more or less we are doing good at the moment, because even though we are having around 30,000 plus cases, the total number of hospital admissions are still less. It's just around 2,500 to 3,000 per day. And even the ICU admissions are not very high. I think this may be just
right, Doctor. But the fear is, whether this will then impact other states. The centre saying that neighbouring states are feeling the effect already. Karnataka has said that people coming from Kerala will have to quarantine there.
Yeah, definitely. That's a concern. That's a genuine concern of the neighbouring states. But we can assure you that the total number of cases may go up in the coming 2-3 days, and maybe up to a week. We have to understand that even after the Onam relaxation, the cases are not jumping up. There is no exponential growth as expected. It's just we were expecting around 60,000, 70,000. Now we have around 30,000 cases, and it may go up a little bit. And we are absolutely sure that the total number of cases will come down. And if we can keep the total number of ICU occupancy and hospital admissions less, we can go through this, and definitely it will not be a problem in another month or so. And also the total number of vaccination rate is also increasing in a very rapid pace, both the first dose and the second doses. So I think we are doing a good work at the moment, and maybe
right. In fact, if we can see those numbers, if we talk about Kerala, then 23.3% of the population has got both doses of the vaccine, and 63.3% have got the first dose of the vaccine. Do you feel the centre needs to reduce the gap between the vaccines so that now we can go ahead and at least get people fully protected, because we do know that single dose doesn't provide the same protection?
Yeah, absolutely. If you look at the scenario of Delta virus infection, we have to give both doses. But one thing, the government is planning to complete the first dose in next 30 days, maybe up to all susceptible population above 60 and all, and will be focusing on the second dose. And I think we can achieve around 60-70% both doses in another 2 to 3 months time, and I think we can even think about opening the entire Kerala.
Opening Kerala. What about the centre's complaint also? Again, NDTV has learned from sources that not enough is being done to track the people who've tested positive, who are in home isolation. They flout the rules and they move around. What would you say to that? Yeah,
definitely. There are some lacunae in that. Definitely the tracing, and definitely the tracing and home isolation, all those things, even the institutional isolation, all those things. It's not up to the mark for the last, especially in the second wave, definitely. But we are trying to rectify that. I think the home isolation. See, there are a lot of clusters in many homes, and also we were not able to trace all contacts. So it is definitely a problem, and we are working on it.
Do you think this is the third wave that Kerala is seeing right now? Because, the ICMR also said that some states that didn't experience, the second wave in a very, wasn't as affected as other states. They're the ones who are going to be seeing these surges. So is this, a third wave just being exhibited there in Kerala?
No, we cannot say that it is it's a third wave. What we are seeing is just an upsurge. Just after this Onam relaxations happen. So I think that will come down in another week or so, maybe in 10 days or 15 days time, it will come down definitely. So I don't think we are, and many people working on the COVID data, they believe that it is not the third wave. Hopefully, right. And yeah.
All right. Well, hopefully we will, see the numbers coming down soon. You said it's going to take another week or so, but that means numbers will continue to rise then. And such a significant proportion of India's numbers currently coming from Kerala. Thank you so much, Dr. Sulphi, for joining us on the program.